Gucci Turban.
Gucci Turban.
Gucci Turban.
Gucci Turban.
Gucci Turban.
Gucci Turban.
Hey everybody, welcome to the Gucci Turban podcast. I'm one of your hosts, Nimesh Patel. This is my co-host, Asif Mansoor. Today we'll be talking to Dr. Meena Dasari, a clinical psychologist. We're talking about South Asian mental health. So don't be crazy and tune in. I'm on fire today, man. All right, Gucci Turban fans, it's time for the dad joke of the day where I bother Asif with a dad joke. Let's see what we got. This is fantastic. You're going to hate this one. It's from our dad jokes on Reddit. User, you worry about you. What? No, let's do it again. I fucked it up. Our Gucci Turban listeners, it's time for the dad joke of the day where I read a dad joke from Reddit and bother Asif to no end. This one comes from user, you worry about you. Asif, what did one butt cheek whisper to the other butt cheek?
I have no idea.
Between you and me, something stinks. That's a classic. That's fucking solid. That's solid. Oh my God. What a crappy joke. Said this guy SL Bar in the comments.
These will never make me laugh, but they'll always make me groan. Like there's
That's what happens, man. That's what happens when you don't have a sense of humor. All right, buddy? That is just perfectly written, well timed. I tweaked it a little bit. I upgraded it, but classic joke, good joke, great, fantastic joke. Thank you. You worry about you, which is also just good advice.
I do have a sense of humor. It's just not present right now. Have you seen the state of this country?
Oh, I thought of a terrible pun bicycle joke. I feel like biking is so much more interesting than walking. I mean, walking is just so pedestrian. Solid joke. Wow, man.
I need to now look up the actual definition of a pedestrian.
Pedestrian has two meanings. One that walks.
Oh yeah, it's a person walking along a road. God damn it.
And then the other definition of pedestrian is so boring and like layman.
Yeah.
Solid pun. Double entendre.
Sad state of affairs.
I'm a professional comedian. What's our story of the day, Asif?
Matt Gaetz.
Who's Matt Gaetz?
Matt Gaetz has a secret son named. He's a U.S. representative, hardline. He's the U.S. representative of Florida's first congressional district, and he's a hardline Republican, of course, coming from the Panhandle in Florida. Mm-hmm. And yesterday, he on Twitter revealed that he has a son named Nestor, who is not. We share no blood, and this is a quote from him. We share no blood, but he is my life. He came from Cuba legally, of course. 6 years ago and lives with me in Florida. Now the rumor mill has been spinning because there are videos of him in the past on Twitter Live, and there's a video of him calling him his son, stopping himself after the sound S, and then calling him his helper, which I don't know if that's any fucking better. But Matt Gaetz is 38 and Nestor is 19, so I don't know where that. Yeah. So the rumor mill is spinning, but it's really funny for a GOP congressman to have a Latino adopted son and then also want to throw out immigrants every day. So
yeah, I mean, the first of all, his name is Nestor, which is the most Cuban name I've ever heard. It's classic. And he's 19, so I don't feel too bad making fun of him. But it's always those guys. It's always the hardline guys that have so much shit on them. Like fucking, what's it? Lindsey Graham. Lindsey Graham's gay.
Lady G.
Lady G. Like that. We talked about that last week, right? Like,
Yeah.
I mean, Matt Gates. Good for him. A son that he adopted, allegedly. Is that the rumor? Is it like verified?
That's what he said. He came out and said that he adopted this guy Nestor. This
Or is this like a fucking? is this a Woody Allen, Sun Yi kind of story where this is actually his lover? And let's add to the rumor mill.
I mean, the rumor mill is that he had some relationship with a woman when he was a teenager. This guy Nestor's mom, but it's bizarre either way because he publicly is claiming that he just adopted this man, this 19-year-old man. Let's not forget he's a fucking dude.
But he's been his kid for 6 years, he said?
Yeah.
Oh, okay.
Which
so
is
13.
No, he's 19 now. Nestor is 19.
But he adopted him 6 years ago.
When he was 13, yeah.
Yeah, that's fine. That makes sense.
But he's 32 years old. And he's adopting a 13-year-old. How many 32-year-olds do you know that would adopt a Cuban kid when he's 13?
13-year-old Cuban kid. Maybe he wanted to have him play soccer or baseball. You know, it's just training him to be his next.
The possible, like, either he just enslaved this child and he wanted a live-in butler named Nestor, which is possible because that kind of shit happens more than we think.
Okay.
Or he had a relationship with Nestor's mom when he was 19, and Nestor popped out. Mm-hmm. And option 3, which is the least likely option, is that he found it in his heart to take this young Cuban child into his home, and out of the warmth of his heart, like, you know, Joseph raised a son who wasn't his, that was Jesus Christ. And so Matt Gates, also like Joseph.
Yeah, there's no way that's... Option 4 is banging this dude secretly. And...
That's dark. That's dark.
I mean, I wouldn't put it past Republican Congressman Florida. Like, those 3 things combined is a trifecta of anything is possible. Also, like, we need to bring Maury back and bring this. This should be the series finale of Maury.
Yeah, he's also like one or two of Trump's most like outspoken allies. It's that guy Tom Cotton, which is the most racist name for the most racist man in the world. And Matt Gaetz from Florida and Tom Cotton from Arkansas. Like, these guys, I mean, if you want to find skeletons, you look in those closets.
Yeah, and then they'll show you their Cuban skeletons. Here you go.
Yeah. Yo, here's my secret Cuban son. By the way, fuck Cuba, but not Nestor.
Right.
Fuck Latinos, but not Nestor. Nestor's good.
Nestor's great. Yeah, I mean, the cognitive dissonance required is fantastic.
Gucci Turban.
Don't forget, we have Dr. Meena Dasari, a clinical psychologist, who'll be talking about South Asian mental health. Check it out. Hi.
How are you?
Good. How are you?
Good.
A nice place to quarantine from, it looks like.
This is our outside patio area. We're in the burbs.
Oh, lucky you. This is my one-bedroom apartment living room.
Looks nice. I mean, that's what we would be in if we were still in the city. So we just happened to move out when we did.
You escaped. Good for you. This is my friend Asif. Dr. Meena Dasari.
Hi, Meena. Nice to meet you.
Nice to meet you, too.
I wanted to bring you on because, you know, I don't think South Asians talk about mental health enough. Mm-hmm. And I think our generation, like our age people, I'm 34, Asif's also the same age. I think our generation will be the first to sort of at least broach the topic.
I agree.
Our parents, our grandparents are lost causes in that sense, but
I agree.
So I wanted to like at least start talking about it and get your take on specifically South Asian issues. But at first, like maybe we can just start off by telling us about yourself.
Sounds good. And then maybe just before we start, Asif, maybe you could tell me how you guys know each other, and then it'll help me to sort of think about how to create the connection between us.
Yeah, sure. So Asif and I know each other. We met at Columbia University summer camp like 16
in high school.
18 years ago. Yeah.
Nice.
Yeah.
And then you just stayed in touch. And are you South Asian as well? Like did you grow up here? Did you grow up in India?
I grew up in Queens, so I'm from here, but my family's from Bangladesh.
Got it. Okay. So we'll talk about, South Asian, I think applies to India, Bangladesh, Pakistan. I think we're sort of in that general area, and we're all experiencing very similar issues. So good. I'm glad I could, have us join and talk about these issues.
Yeah, I think like brown people in general it's an interesting group. I don't. Minorities in general don't talk about mental health at all.
No. So my background is I do cognitive behavior therapy in Manhattan. I've been practicing and in private practice for about 15 years. I see kids, adolescents, adults, kind of varying cultures and backgrounds. And I have had, multiple Asian Indian clients. And I also have kept up on the research as far as the group that we're going to talk about. And, thinking about sort of on a bigger scale, like what does the research say? What are we finding as general trends? But also I think, Nimesh, what you want to talk about too is some personal experiences with mental health and being Asian Indian. Is that?
Yeah, for sure.
Okay. Is that a good enough background or?
Yeah. So you were trained at NYU, clinical psychology, PhD from Case Western, if I'm correct?
You got it.
Okay, cool.
And I was faculty at NYU Bellevue for 6 years, worked primarily in pediatrics, but also did research in the surgery department, and kind of bounced around depending on, sort of the research needs and trying to understand different populations within Bellevue and NYU.
What about being, I don't want to assume your background, I'm assuming you're Indian?
Yes.
Okay.
I was born in India, came here when I was 1 year old, and I grew up in Cleveland, Ohio. So, very few Indian people there.
Right.
And I think, as I had my own personal journey with mental health, obviously. And then when I trained to be a psychologist, I definitely made a point of incorporating in understanding mental health in South Asian communities. And that's kind of what led me to be interested when you contacted me about the podcast.
When did you make the move at what point in your medical career or your training career did you decide, okay, psychology is what I want to be doing and I want to focus on South Asians? What was it about how you grew up that you were like, I need to angle it towards South Asians?
I think it's because two things. One is I grew up in a community that was predominantly white. I was like one of 6 minorities in a 1,200 person school. And I think experiencing those mental health issues in such a small, in a population where, being Asian Indian was viewed as different and kind of, misunderstood. So I just felt like I always felt like I was kind of on this island by myself trying to understand these mental health issues. And I've gone through periods of feeling depressed and anxious. And then I think when I got to college and started taking psychology courses, and, there is definitely some talk about, cross-cultural mental health issues. I think I really gravitated towards understanding it more, and then pursued a PhD in psychology after graduating from college. So I think they've both been interests of mine, is psychology and Asian Indian mental health. And then the PhD allowed me to kind of integrate those more.
So have you seen a lot of South Asian mental health patients now that?
No, I wish I did, but I think, I would love to hear both of your thoughts on, kind of the stigma, but I think if we look at the research and we look at what's, the rates of mental health issues in South Asians and the rates of the rates of South Asians actually getting treatment, that's where we see kind of the, significant discrepancy. Like mental health is definitely an issue in South Asian cultures, but people aren't getting to treatment. I mean, if we look at, the research is showing that there's just a very much of an unmet need as far as treatment utilization in South Asian cultures.
I mean, I know from my personal experience, it took a lot of, I don't know what gumption is the right word. I don't think there was a fear. I think it was more just like, I'm better than this. Like I didn't want to admit that, okay, maybe talking to somebody was worth doing. Like I pride myself in my ability to figure problems out. So why wouldn't I be able to just figure out what's going on in my own head? And then my rudimentary understanding of psychology from Wikipedia is, just trace some family event or some large family arc to how I feel about things now, and going to a psychologist when I went in February kind of confirmed a lot of it, but it was more just like articulating those thoughts, because the questions required to articulate those thoughts I wasn't asking myself.
Yeah.
Does that make sense?
Yeah. And I think also, like one of the common feelings that gets in the way of, Asian Americans, Asian Indians seeking mental health is kind of this feeling of shame and, this belief, like you said, is I should be able to figure it out on my own. Like I'm kind of almost like I'm admitting defeat if I go into this therapist's office. So yeah, I think is that similar to sort of what you were experiencing when you reached out?
Yeah, I think I don't want to say defeat. It was more just like I have to start the fight.
Yeah.
You know what I mean? Like I knew there was something I was wrestling with because I was talking to the bottom of a gin bottle every day. It's like not like alcoholism, but just I was drinking a lot more than I would, and like smoking weed a lot more than I would, and it was like, and I knew in my head, I'm like, I'm probably just dealing with stress, but I couldn't bring myself to be like, this isn't something I'm going to be able to solve myself. So let me see if I can start this fight with the help of somebody else.
Yeah, that makes sense. And do you, had you experienced some of these issues before?
I don't, I can't articulate or I can't say that I hadn't thought about going to see somebody well into even my 20s and 30s, but like it just never thought, I never put the time in to be like, is there a benefit to this? And I could say wholeheartedly that there is, because there were things I said in the therapy session that I knew I always felt but I never said about my family and stuff. And so it was definitely beneficial to go, but I never was cognizant of needing the help until like this year.
Sure. And and I think a lot of Asian Indians kind of struggle with that, is like, I know I need help, but what do I do? Right. What do you think are we look at the research and we know that, there's cultural factors that impact getting mental health treatment, right? So what would you both think are some of the cultural factors that impact whether people actually get to a therapist's office? This is kind of brainstorming and talking it out. I have some ideas as well, but I would like to hear from your perspective what you think interferes with people getting the treatment that, I think there's definitely the need, right?
Yeah, that's it.
Well, I know from my experience, I tried to have a conversation with my parents about my mental health in college. And so specifically, like my folks and the way I was raised was without the traditional like regiment or structure that most South Asian, kids have, like do well in school, become a doctor or a lawyer, and that's kind of the prime directive, and then get married, right? There's like a certain kind of path.
There's like a template.
A template, and it's like boilerplate. Like my parents, I didn't grow up with any of that. So when I tried to broach the topic of my depression and anxiety with my parents in college, I remember my dad specifically saying, I don't like depression doesn't exist.
Yeah.
Like that's a white people American thing. It's of like, and it was interesting because I started to have questions about if, I think, and I don't know you would think that depression and anxiety has existed as long as humans have existed, right?
I would agree. Yeah.
And I wondered if they're culturally, it was so suppressed for them, because the one thing my dad did say to me was that, I came from Bangladesh and I immigrated here with $100 in my pocket, and I never felt depression for a day in my life. So it was kind of like a moral failing.
Yeah.
That you can't deal with a job search or unemployment or whatever I was going through at the time. So I think, for me in particular, I was trapped in feeling like, hey, maybe it is a moral failing, and whatever the solution is, it's going to be borne on my back alone anyway. Like whether I decide to go to a therapist or tell my physician about it, which I ultimately did 7 years later.
Sure.
I'm going to animate this whole thing. So it was tough. I mean, my folks still don't believe in depression as a real thing.
Mm-hmm.
I mean,
yeah.
It's kind of like, well, they the generation above us they left everything they knew and they came here, and they were like, well, we are doing relatively well, get your shit together.
Yeah, exactly.
But then you realize, oh wait, dad's drinking in the garage and mom's praying a lot more than normal people pray. Like it's like,
and there's a lot of fighting between them, and
right. It's just like there are clearly ways of coping that aren't being addressed, or people are coping some way or another, whether it be Johnny Walker Black or praying to Ganesh every morning for 3 hours. It's like it's that like religion. I mean, therapy, religion, and the bottle are almost like the three sides of the same coin, except therapy is actually like beneficial. Religion is in my opinion beneficial to an extent, and the bottle is the bottle. But I think culturally, there was nothing cultural for me to even think, oh, I have mental health issues. It was more just personal, just like, should I even, what is depression? Who has that? Like, what is that? And I haven't been diagnosed with depression, so I can't speak with authority about it, but I just know that, there's nothing wrong with saying that you may have that. It's like admitting, oh yeah, I go to the gym, like my biceps are weak, so I need to go strengthen that, or I got to put some, what's it called, bench presses. I got put some plates up because I'm not as strong as I should be. So, but the I don't know if it's a stigma or just something that's not articulated as a problem that could be solved.
Yeah.
Maybe that's it. That's my thought of it. At least my experience. My experience is different.
I think that's right.
Because I never broached the idea. My parents will watch this YouTube video and be like, "What you have?" Like that's what's gonna happen.
Wait, we're on YouTube? I thought
this is gonna go on YouTube. For sure.
Oh my gosh! I didn't know that.
But
glad I showered.
No worries. So the background is perfect. But they'll watch this and be like, what? Like we didn't know you were feeling anything. But that's because it's not something people articulate. Yeah,
I think that's right. And it's also there's a research study that shows exactly what you're saying, which is that, it's literally, I'm reading from this, it's Asian immigrants or Asian Indians do not consider counseling or therapy as an option for problem resolution, right? So it's the idea that, you might identify the need, but you don't necessarily identify therapy as a way to, meet that need, right?
Yeah.
So I think that that's actually really very true about our culture.
Yeah, I got to get better at marketing. That's what it is. Like,
I have to, right?
Yeah,
I'm only there like one of three. I better just put myself out there. So
it needs to be a Planet Fitness for mental health. And then you'll like $10 a month, and you'll eat Pizza Fridays or whatever the fuck they do. It'll be off the charts. Like I joke, but it's also kind of true. Like mental health exercises would be pretty beneficial. I think the instant you gamify mental health or make it like something they could get graded at, every Indian person and Asian person, like, we gotta fucking do this. We're gonna dominate this too. We'll be the happiest people on the planet. We'll show you. Like, there's a thought. Let's do that. All right, podcast over. Asif, we gotta get to developing business plan.
This new iOS app.
Yeah.
It's really funny. So the other thing that I thought was interesting as I was like reading up on, Asian Indian mental health trends, and was one of the two sort of recommended courses of treatment that tend to be more effective with Asian Indians. One is like CBT, so cognitive behavioral therapy, which is what I do. Asian Indians tend to tolerate it better because it's more directive. It's more kind of like, I'm telling you what to do kind of thing.
We love being told what to do. We can follow orders.
Well, versus like more of the talk therapy, like sit on my couch and tell me about yourself. That we're finding, seems to be less tolerated by Asian Indians, which I think is interesting. And then the other one,
tolerated. What do you mean?
Well,
we don't talk on the couch. Or?
Well, no, it's more that the like there's, you talk about what people choose to do, right? And if they're going to choose therapy, they're going to choose CBT over a talk therapy approach. And also, if they are starting more of a talk therapy approach, we're finding that they don't stick with it, right? So that it doesn't tend to be they tend to find that that's not the method that they wanted to be exploring the issue. Whereas, CBT is more directive, it's problem focused. So, that Asian Indians seem to be responding better to that approach. And then family therapy. Yeah. Could
you give an example of what, I am not familiar with what CBT
Oh yeah,
is,
sure. So let's take, I specialize in anxiety treatments, and I use, cognitive behavioral therapy. So what you would do, there's a pretty specific gold standard or protocol that tends to be effective for anxiety. So, phase one, the first 6 to 8 sessions is typically developing very kind of standardized strategies for managing anxiety. So relaxation, changing your thinking, then, moving into sort of like distraction techniques. And then phase 2 is practicing those things. We call it exposure more formally. And that's the idea of, you take all the strategies that you've learned, how do you apply it systematically to, specific anxiety triggers? Which again, like that's, as you can hear, is very kind of like protocol based, and probably more consistent with like a medical approach, So that is kind of the type of treatment that Asian Indians tend to respond better to.
What works better though? Like is talk therapy in not just Asians, but in general, like in the general population?
That's a great question. CBT, hands down. I mean, it tends to be most effective across the board, right? Mm-hmm. For multiple diagnoses and age ranges and disorders. So, so I think to answer your question, it's CBT hands down.
So like I'm not saying I have it, but for example, if I had anxiety, you would tell me, write down all your problems. Like what is a step?
Well, you would walk in. Well, and here's the thing, you want to think about therapy as kind of like, if you get a skilled clinician, they should be able to like apply these techniques in the context of a relationship, right? Like you're not going to walk in and hand you a work, you're not going to walk in and I wouldn't hand you a worksheet, but we would start with talking through what are your concerns, right? And if we identified it as anxiety or depression, let's just stick with anxiety because that's, like I said, my specialty. If we identified it as anxiety, we'd start with understanding your anxiety, sort of what are the triggers, what are some of the reactions, what are your thought patterns, what are the behaviors that correspond to your anxiety, right? So really mapping out what the anxiety looks like. And then we would teach you relaxation that targets more of the somatic stuff, right? Like when you experience like the heart racing and the, kind of like the tenseness, that kind of thing. We know that deep breathing relaxation techniques are effective in decreasing the physiological aspects of the anxiety. Then we would talk about sort of your negative thought patterns that maintain the anxiety, right? So you think about somebody, you know, going into an elevator saying, I'm going to get trapped, I'll never get out, I'm going to die, you know, is going to be anxious, rather than a person who's getting in an elevator saying, okay, I'm going to floor 3. Once I get there, I'm just going to go meet my friend or whatever. So, you know, we target those negative thought patterns and try to shift them into more positive thought patterns, or neutral even. And then we just add, you know, supplemental strategies based on what we feel is maintaining the anxiety. So, you know, let's say it's, you know, not being assertive enough, or, you know, not having problem solving skills. So we would add some of those skills to the work. And then when we got to the practice phase, we'd pull those all together, and, you know, we build what's called like a, you know, like a hierarchy of things you're going to practice. So let's say for somebody who has like social anxiety, first would be to, you know, the fear of like meeting new people is what we're going to expose them to. So we would start with something small, like, you know, I didn't know what that look was, but
the
no,
fear of meeting new people, you throw them into a party and say,
yeah, exactly. Or, you know, you start with somewhere where they are going with a close friend to a new party, like, you know, where they don't know anyone, right? And then the next time maybe they go to a, you know, party without that friend. And then, you know, then we like kind of increase the expectations, getting to a point where maybe they go on a job interview, or, you know, a date on Match.com or something like that, you know? So the idea being like, you know, you want to help each individual be able to apply those anxiety skills in an effective way. And it's most effective to be able to do it with the guidance of the therapist, right? So that's CBT.
The first time I went, it was talk.
Yeah, it sounds like it.
It was just the psychologist sat there and asked me about my parents. And I was like, oh shit. And then like at the last 10 minutes, I said shit I'd never said before. I was like, oh, this is interesting. But then she charged me $250. I was like, yeah, I'm going to stick to doing drugs. You know, like, why? I'll stick to, no, I'm not advocating it. Please don't take that as a endorsement for Molly or shrooms.
I'm not taking it personally.
But I mean, Molly's.
No, I'm sorry that was your experience, though.
It was. You know? For. I mean, it wasn't you, but also it was. I think that's like the normal rate, from what I gather. It was like $250 an hour or something. Molly is $20 a dose. So it's a fair trade-off, I feel like. But
oh boy.
Just maybe a segue to what are your thoughts, and we can come back to CBT versus talk, but what are your thoughts on like the research on, you know, MDMA or ketamine or whatever? I know Asif has more knowledge about this. Maybe Asif, you can.
Yeah, could you jump in, Asif?
No, I mean, I know at least my journey of like searching for like relief, I guess I'd put it that way. Yeah. I've tried CBT, which I didn't enjoy. I like talk therapy a lot more. Yeah. No, I mean, I don't like being told what to do. I think that's probably like, I have deep-rooted issues with authority, so I don't like.
Yeah, no, that's fair. And also, you know, I mean, it really depends on the therapist too. I mean, you know, I feel like if you would probably had the right fit, the person would have worked more with that and treated it more collaboratively, maybe.
Maybe, I mean, I will say like every professional I've seen has been like amazing, like in terms of like their kindness, compassion. Like I haven't had any like horror stories with it, but you know, I did try ketamine treatments, which are prohibitively expensive. Yeah. And I didn't really find that you can get referred to them, but also you can just go. You can just like immediately, I think you get a consultation and you can just come back, and it's like 4 to 6 sessions, and it has to be done, administered over like some kind of period of time. It's not like a one and done. Like the first time you go, you won't feel anything. I didn't feel anything. Okay. But yeah, I mean, I've tried.
After you tried CBT and different therapies? Okay.
I tried CBT, and then I tried a psilocybin therapy, which was done, you know, maybe not super legally, but not in the state for the feds that are watching this. but I thought that was probably that was the best experience I had.
Okay.
Along with doing some talk therapy. But I felt like, I think all in all, I felt, the source of my depression and anxiety was definitely how I was interacting with society, like myself as a working professional, just trying to make it in this world, right? The rat race.
Right.
And I'm sure that's definitely for a lot of other folks, that's definitely the source of their anxiety and their depression. But there's definitely something deeper in terms of like, because I'd been given a formal diagnosis of having depression. But there was there's a deep layer to it, but then my anxiety, which got pretty debilitating, was coming from, my work life and that kind of stress. So in that sense, like I found it to be kind of lacking. Like I didn't really ever find anything that would help me get through my days a bit better without having to add another thing to think about. Like it becomes more stressful to have like, all right, well now I need to have this, this technique to deal with this, So yeah, I mean, I think in recent years, I've been more focused on meditation and like self-care.
Great.
But it is still like, I still haven't found a way to relate my journey with my mental health to anybody else that needs it. Like it's kind of hard because I haven't really like kind of enjoyed any of these. Like I haven't stayed in them for a long time. Like, you've only tried them like six to 8 months each thing.
Yeah. Right. Right.
Yeah. I mean, I only did one session of the talk therapy, but I did with psilocybin, shrooms, but like microdosed it too. I'm still pretty strong-minded in the sense I'll figure something out, So I had a friend who gave me some shrooms, and I took like not a trip amount, but enough to like trigger something in my brain. And then I was listening to music with my fiance, and I cried for like 30 minutes about just like family stuff. And I was like, I realized that a lot of my, I don't know what to say, let's just say anxiety for the lack of a better term.
Right,
but
right.
It wasn't anxiety, more just like whatever was heavy in my chest was a lot of like, I've experienced some loss in the last like 2-3 years, and just like, I've come to terms with what is meaningful to me, which is spending time with family, but the ability to execute on that has been lacking.
Yeah.
For faults of my own, but also through no fault of my own. And it's just been like, I don't know what's going to happen in the world. I don't know what's going to happen with my family. Like it's fucking nuts. And that was like, okay, maybe talk therapy might make sense if I can be on shrooms the whole time.
Yeah.
But I'm kidding. But like that just sort of opened up the window to be like, maybe I should go back. Like maybe I should talk more, because there's clearly stuff I haven't aired out, but I'm definitely feeling,
Yeah, right. No, that makes sense. I mean, I think what both of you are talking about is, I think you're starting the mental health journey. Well, Asif, I think it sounds like you've, been doing this for several years, but I think that that's the other thing for, Asian Indians, is just that process of getting started. I think both of you, I think that's great that both of you have started it. And I think that's the challenge, is how do we get more people to start it,
But I like when I was at SNL is when I first started needing to like even start thinking about going to therapy, because I was so stressed while I was there. That I started looking into. It took me like 6-7 months to even like Google where are Indian therapists while I was at the show, and I realized like there were barely any in the city, and there was no one doing anything for specifically South Asian Americans.
That's right.
And I don't. Something in my head told me instinctively like maybe an Indian person who knows what it is to grow up Indian will have even some marginal benefit in terms of seeing them versus just going to like a standard therapist.
Yeah.
But but I don't know if that is necessarily true. All that to say, like that's when I started it, and that was 3 years ago now. And I started meditating. I started like
that's great.
turning to religion, like working out like crazy, like anything I could do to anything that people said you should try to do, I did. But all that to say, like, if you're 16 and watching this, or 10 and whatever it is, like, start thinking about it now, because it's the same as going to the gym. It's the same as, running every day. Like, your brain is an organ or muscle. Like, you need to train it and work it and let it recover and heal and all that,
Yeah, I think that's absolutely right. And I think, and they're not mutually exclusive, right? Like, I think the things you're talking about, which is self-care and meditation, are part of now, like, more CBT and, some talk therapists incorporated in too. But I think that's absolutely right. Like, why not treat it as part of taking care of yourself,
Yeah. Yeah. Going back to what I said, like, have you found, or is there research that indicates, like, having someone who looks like you and has grown up the way you may have, to a certain extent, beneficial in who you're in treatment? Like, is it better for an Indian person to talk to an Indian person? Is it better for a Chinese person to talk to a Chinese person?
Yeah, no, that's a good, I mean, there is research to suggest, like, should you seek out somebody, from your same cultural background? We're finding there really isn't, like, a distinct, like, effect on outcome, like, meaning for an Indian person to see an Indian person, does it give you a better outcome than if you didn't see an Indian person? We're not seeing any strong effects to that, to support that.
How do you measure outcome?
Well, you can look at anxiety rating scales, you can look at depression rating scales. So you look at symptoms, yes. Or you can look at patient satisfaction. I mean, outcomes can range. I'm just sort of generalizing, but yeah, it depends. I mean, some studies will kind of, like, generically look at outcomes. Some will look at symptom-based outcomes. And, but I think what we're finding is that if the therapist is sort of culturally proficient, meaning they sort of understand and can really connect with that person and their cultural background, that it really, that's actually the most important.
Got it. Okay. So I think a lot of it, for me, the hesitancy to see someone was also, like, should I just go to the Indian person? Should I see an Indian person? But from what it sounds like, that shouldn't be a barrier to entry. It should like, see whoever, because it's going to be a journey to find the one that works for you anyway, or what works for you anyway. Asif, did you see just Indian people or Bengali people? Or?
I haven't seen anybody, no POCs in any of my journey. And I remember I wanted to find, the Times had an article about an East Asian therapist and like the growing need for young East Asians to find somebody that looked like them. And for me, in my experience, the only time I really felt like I needed to maybe find someone who was at least Asian in some way, shape, or form is when my talk therapist started to go down the generational trauma route. And, generational trauma, just at least from a layman's, is that your parents say things to you that their parents said to them that are causing, this kind of loop, this vicious cycle, whatever you want to call it. But their trauma and their negative behavior has been passed down through the generations. And so when we started going down that, that branch, I kind of wanted to start to talk to somebody that was at least South Asian or Asian that could really understand, I felt like it was a bit different, because if they were talking about generational trauma, which I'm sure everybody can experience if you're white, whatever, all races kind of can experience generational trauma, but they really couldn't pinpoint specifically how Asians experience that, because it's usually from the lens of, like, you're not on this plan I have laid out for you, and you're off this plan. So anytime my parents got quote unquote toxic, or even when anecdotally talking to our friends, anytime our friends were like, hey, I don't want to be a doctor, I want to be a writer, and you're dealing now with this whole deluge of BS, but it's coming from a place where their grandparents said that to their parents, and now their parents are saying that to them. I feel like I didn't really get a lot of help. And the therapist did a great job in some sense, but they didn't really understand what it was like for my parents to come to America, for their parents to claw themselves out of poverty, and then colonialism really is what they experienced.
Yeah.
And so, you know, I feel like the examination of it was kind of weak, and that's when I started to really pull back from going to talk therapy and seeing my therapist.
Mm-hmm.
So every South Asian therapist must also have like a history degree in like what colonialism does to like our grandparents. I know definitely 1,000%. My mom has experienced generational trauma from just like how she reacted when, you know, I didn't become a doctor, you know, just like how, and what growing up, like she experienced a lot of colorism, so that played a part in like what decisions I made, because she's like, well, if you're this color or if you're brown, like they won't let you do this in America, you know, like you should be doing this, this, and this. And I was like, part of it was like, that's BS, you know, because this is America. But also looking back, I'm like, I can see why and how you would frame things that way. And I think what a therapist might be able to do is sort of break that trauma chain. Like, well, this is the context in which your parents are operating. This is the context in which you're operating. You need to
that's absolutely right.
separate the two, right?
Yeah, and I think also what therapy allows is some objectivity, right? So, I mean, you've been given these messages, and you know, a lot of your thought process has a developmental history, right? Like, meaning, why do you think the way you think, right? It's not that you wake up and think that way one day. It's significant experiences within your life or messages that you've heard from, you know, significant people in your life that have shaped the way you think about yourself, the world, and others, right? So I think therapy allows you to like kind of step back and analyze, you know, your thought patterns and see which ones work, you know, and are helpful, and which ones don't work, you know, and are creating the anxiety, the depression, the sadness, the, you know, whatever, you know, negative feelings that you're working on with your therapist.
In your experience with the patients that you work with, like, have you seen the South Asian influence on how people are thinking, or how your adolescents or the pediatric patients that you see or the adults that you see, like, or is it more the world that we're in now, just all that?
I can think back, there's an example that stands out from graduate school that I could share, is where I was working with an Asian Indian. So I was in, you know, graduate school as, you know, a trainee, and I had an Asian Indian patient who came to me because they were having performance anxiety about the MCAT. And he had consistently performed poorly on the MCAT, so he was trying to take it for a third time, increase his score. And I was working with him on anxiety management strategies, thinking, you know, let's work on the anxiety and let's see where you get. And it was interesting because I presented the case to my CBT group, right? So we have a supervision group as part of graduate school when you're in training. And everybody was white except for me. And I just remember the group saying to me, well, why are you focusing on the MCAT with him? Why don't you just tell him to focus on a different career? And I remember sitting in class being like, I don't think they could understand this unless they were Asian Indian, you know, because it's so ingrained in him to want this, and on such a subconscious and conscious level, right? And, you know, for me to step in and say, well, instead of working on the performance anxiety, I'm going to help you work on your, you know, defining a different career for yourself. I think being Asian Indian allowed me to understand why I couldn't take that approach, because I needed him to figure it out for himself, right? So I think that example really stands out to me.
He was so indoctrinated to be a doctor.
He was so, I mean, the thought of not taking the MCAT was like, I mean, if I had said it, it would have looked like my head was on fire. I mean, he would have looked at me like I was speaking a different language, you know, because the thought had not even occurred to him.
That's nuts. What do you mean I'm not going to take the MCAT?
Exactly. Can you imagine?
Oh, wait, 22 years?
But that's the thing. I mean, I think that there is, you know, I mean, you know, when we look at the research, it's more, you know, group data and everything like that. So we don't, you know, kind of the need for a Asian Indian therapist probably gets washed out when you look at group effects. But I mean, in specific cases, I do think that it's important to have someone from your own culture, you know?
Yeah, I mean, that's interesting because I've certainly had friends, and this is anecdotal, but in the same boat, right, where they not being able to go to medical school, and specifically medical school, set off this chain of depression and like self-loathing.
Oh yeah.
And I think it makes it more difficult being a South Asian person, because if you feel like there's any kind of moral failure to seeking help in the first place,
Yes.
then you go to a therapist and they're like, oh, no, you have to redefine your goals. Like you can't.
Exactly. Yeah.
And so it's like, it almost feels like you're leading people into like this, like a no-win situation, which is not what therapy should be or is really. But,
Yeah.
you know, I'm even curious what you say to people like that. I mean, what really is the right way, and how people how should people move on? Because I think specifically with med school and even law school, like those institutions will cut you out if you don't meet a certain level, right?
Absolutely.
Like it's not like you could be like, you know, you can't really be, I mean, you could be a crappy doctor, but you still need to go through like, you know, some hoops and some structure. But,
Right.
you know, I'm curious how you would even deal with, you know, people who are experiencing that, because I'm sure a lot of people are, you know, that like they maybe have to redefine their goals.
I think that's a very good point. I mean, you know, I think I look at it as, you know, you kind of think about it from a perspective of somebody's like development, right? Like, you know, intellectual and social emotional development. I mean, I think that's part of the process. If you look at it, I look at it as, you know, I wouldn't call it a failure, I'd call it a setback, right? And we talk about resilience and building resilience when we think of a setback. And we talk about in therapy, how I approach it is, you know, how do we define where to go next? And how do we, you know, shift your thought process to this is a new opportunity rather than this is a failure, right? So, you know, and I'm talking in, you know, I'm saying kind of what we would do. I mean, we're talking multiple sessions. We're not talking about, you know, I'm going to tell them this is how to think about it, but that's the journey that I take with them.
I think for me, like after, like what was it, junior year in college, I dropped pre-med.
After organic chemistry?
After Orgo 1 or 2.
That's all right?
After Orgo 1, I was like, nah, dude.
Yeah.
But, you know, like I started Orgo 2 and I was like, I don't give a shit about any of this. And I knew at that point that medicine was one of those things that if your heart's not in it, you're not going to do it. Like you should not do it. It will be a tremendous waste of your life. So I didn't go through the oh shit, I'm not going to be a doctor thought process. It was more like, all right, what am I going to do now?
Yes, exactly.
Now, whatever I do, I have to be wildly successful. A, to like redeem myself, and then B, to redeem all the investment and heartbreak that my parents went through to make sure I followed this path, and then I didn't. That's where I think my sort of
I think that's right.
Because my anxiety or stress or whatever comes from is because within the South Asian and Asian community, all we see is paradigms of success, right? All we see is like super successful people, even the least successful person I know is a doctor. You know, it's like that is the like the level, that's the bar we're all reaching for.
Yeah.
And when that's the only thing that exists around you, that I can see how that stress sort of ingrains into your brain. Like, oh shit, I got to make something of my life. And that's where my shit comes from. It's like, I got to get this 1 bedroom and get to a 2 bedroom. And then, you know, it's just like that, even the small shit, you know?
No, I think that's right. I mean, I remember telling my parents I was going to, you know, switch to a psychology major, and I'd been pre-med, and they were just like, oh, we give up on you then. You know, it's like, it's like you're kind of like, I mean, it wasn't like you're dead to us kind of thing, but you know, it's like, oh, you know, you've switched to something that we can't no longer support you, you know, like I'd started, you know, becoming a criminal or something. But I think exactly what you're saying is, you know, Asif, you brought it up. I mean, what could I do as a therapist to help someone navigate that process. And I think the key is to be able to shift the thought process, right? Again, that this is an opportunity to figure out what you want to do rather than, and you don't say this to them, but, there's a potential of failing pursuing something you don't want to do, so we talk more about new opportunities. How do you change your thinking? You have, being Asian Asian Indian in the United States, right? You have the opportunity to incorporate in a lot of thought about, this culture values creativity and different professions. And, you're not so tied to the Indian community that there's no other alternative.
Interesting. I hope people listening hear that,
Yeah, but it's true, right?
I hope there's someone on the fence right now. It's like, oh yeah,
No,
there's other shit I could be doing.
No, it's true. I think, had I continued pre-med, yeah, I'm sure I would have enjoyed the journey, but I love being a psychologist, so I think there's something to be said for people like us who have pursued not the norm, but have, found an alternative and really allowed it to, be a connection for them that was meaningful.
Yeah, that's great. I hope we can help people with this. What trends are you seeing now? Like, are more South Asians going to therapy, or is it still like?
No.
No.
I feel like right now with COVID and all this, we're on the front lines on both sides, right?
I know.
So,
no, it's true. I think what I am seeing is I do get, a lot of calls from Asian Indian families. What I see, at least with, more of because I see kids and adults, as I mentioned, but with the kids, I see a lot more of the issues are more based on like the family dynamics. And, it's interesting because I typically get the kids, right? They're the patient that's identified as a person having the issues, but really the issues are kind of representative of things going on in the family. And I think that what I see is, the ability, once the psychiatric symptoms get so extreme that the family can no longer handle them, that's when I get the kids in my office. But the family is really reluctant to really allow the treatment to work within the family system. So I often feel really stuck is kind of what I've come up with. And yeah, I get to a
because the
point where
parents are like, we're not gonna.
Yeah.
You need to talk to us. This is something wrong with this kid.
No,
right?
just fix my kid, because the kid is depressed or anxious. Fix the kid, right? And, when I get to the point where, we've reduced the symptoms or they've gotten better, then I approach the family and I say, well, let's talk about ways that we might be able to kind of shift the environment to be able to, kind of help decrease the symptoms. As they're kind of like, that's usually when I get fired.
I'm sorry. Sorry, our parents are. I know. I've been expecting. You're not talking to me.
No, I know. No, but it's true. I do, and I get it. Look, I could stay silent and not say anything, but I think the idea is I owe my patient, the child, that I owe them. Not owe them, I should say. It's in their best interest to at least try to impact the family system.
Yeah. I can't think of a group of people that need therapy more than people who came from wherever the hell they came from and then landed here with nothing.
They talk about, acculturation is a big part of talking about, Asian Indians and getting help. And then idea of how much you're integrated into the culture, just the process of migration, like it's very stressful, So I think that's absolutely right. The other thing that I was curious if you both want to comment on, and I don't know if you have personal, like not you personally, but if you have any friends that, we're finding like, there's suicide rates in Asian Indians. We're finding it's higher in Asian Indian women than in men or Indian people or Indian women in India, right? So just curious if you've had any experience where friends, where friends have been dealing with, or, I just find this to be kind of such a big red flag that more mental health services are needed, because these people have really slipped through the cracks if it's gotten to that point, right?
Yeah, I mean, I specifically in my, I guess, call it the South Asian community in Queens, I had a cousin who was a ER doctor, and she was a resident there, and a lot of South Asian women would come in with like phantom pains, which is a pretty common thing.
That's very common in Asian Indians, is like somaticizing symptoms, meaning like focusing on the physical rather than the actual emotional part of it, right?
Yeah, and that was their way to reach out for help, because I mean, their husbands wouldn't allow, I mean, they're in a very patriarchal kind of relationship, and their husbands wouldn't allow them to see you, but if they could kind of create some phantom pain, go to an ER doctor, they talk to an ER physician about it, who's also not really trained to help them, you know, because you're at a trauma center and you're trying to talk about, you know, some personal issue or some emotional issue. So I know that there's definitely a larger need for it in like the Asian community. I just feel like it's cost prohibitive for some of these folks to go and see a therapist, whereas making up a pain and going to like, you know, a trauma center is.
It's covered by insurance.
Yeah.
Yeah. So, I mean, that's a good point, that the health system sort of maintains the, you know, that you have the benefit of insurance covering it, but also your family supporting if it's somatic symptoms, right?
Maybe that's why like maybe that stigma exists, because like if I were to go to therapy, then my parents would think, oh, then people are gonna think something wrong with us.
Yeah. Oh, exactly. Or that we failed.
Right?
That we failed as parents, you know?
When that's not really the case.
No.
Right? Like I know great parents whose kids have mental health issues, and people who are great kids whose parents clearly have mental health issues, right? So it's like, I think personally, I've definitely seen like a lot of people, even within my family, who need therapy and then go, and they've benefited tremendously from it.
Mm-hmm.
I can't speak to the South Asian female community, but I do know that my sister has told me like her friends have gone, and like they've benefited greatly from it. I just don't think it's fully normalized yet. I don't think it's even normalized in the broader community of America at all, but to the extent that it should be, like I think South Asians are pretty far behind. But I'm still struggling to understand like why that fully is. Like it doesn't seem like there's anything wrong with going to it.
No.
You know? I don't know.
Well, I think it's funny because so many South Asians cling to become medical professionals, but they won't. They're not okay with their children seeing a medical professional for a psychological disorder. And
that's interesting, isn't it?
Yeah. And I also feel like there's this trend where it's more acceptable to go to a psychiatrist and get medication than it is to go to therapy and talk about your issues, right? Like, you know, there's this like, oh, okay, well, you know, I feel like that I've noticed that on a personal level. I'm not saying that, you know, I don't know if either of you have noticed that as well.
You can shit on psychiatry all you want. Those fucking pill pushers.
Yeah, man, they can well and orgo.
No, I haven't seen that. I mean, maybe within the South Asian community, just people at large, like the DMD just holds some kind of different weight.
Yeah, that's what I'm wondering. When
really it's just like, why take Prozac and Xanax if you can talk your way out of stuff or talk yourself into stuff?
Yeah.
And then like the same on the you know, tangentially, like people are so quick to dismiss. I know, like if my parents know I smoke weed, but if like other people's parents found out they smoke, like, why are you smoking weed? But or doing shrooms or Molly or whatever, but easily it's just like, just take Xanax. It's like, what? It's the same drug, you know, it's like.
It's another drug replacing another drug, right?
Right.
Yeah.
It's odd to me. But yeah, sorry, to short answer to your question. No, I haven't seen people go to psychiatry versus psychology. I think the issue is just like even deciding to go to therapy in the first place.
Yeah, that's fair.
And Asif's point of how are you going to push your kids to be doctors, but then not acknowledge the fact that the brain is a very fragile thing and needs a lot of attention and is the most important part of your body.
Right. Agreed.
Yeah. All right. I mean, we're at 1:00. I mean, I could keep talking about mental health, but if you have any other questions, I feel like this has been like a joint therapy session for Asif and I. This is cool.
No, I mean, I think just to end off, it'd be, if you have any kind of advice, especially for people who are listening or a bit younger, on how to seek help, how to seek help either, or anything you could kind of offer as guidance or advice for them, or maybe a bit younger, wherever people are in their journey to kind of, with their mental health.
No,
and not just South Asians, like everybody.
Everybody.
Yeah, no, that's a great question. And I think, I'll start specific to South Asians and, kind of generally anybody sort of struggling with mental health. I would say start with, especially for South Asians, I would start with a really trusted family member, to be honest, because I feel like if you can talk to the uncle that's very open-minded, or the sister that's also gone through mental health issues, just to feel like, help you normalize some of your experience. So I would start there, right, as just an entry point, and then start to think about therapy more consistently as a way to help you move forward instead of staying stuck in the feelings, right? So consider, therapy and, what would you want your goals to be, and seek out therapists that sort of match that. I think this is harder for the younger kids who, obviously when you're 16, you need a parent's consent to go to therapy. And this is where if you're a younger child, or if you're, under the age of 18, I would find, a school psychologist and see if you can work with them to advocate with the family, because parents, especially South Asian parents, take school demands very seriously, right? So I found that a lot of times the Asian Indians kids got to me through the school psychologist, where, they formed this relationship with the school psychologist, and the school psychologist could, present it as, we know mental health issues can interfere with academic performance, tie it to a specific, consequence that they would find significant enough to really kind of overcome the stigma to be able to seek out the therapist. And I think what you're doing, Nimesh and Asif, is, talk about this stuff. I mean, get it out there, I think there shouldn't be the stigma of, I have this issue, no one else has it, or it's only the kids with really, the kids that nobody talks about that have these issues. It's people that are my friends. It's people that that are successful in other fields. It's people that are good people. So I think, having these kind of dialogues is really important.
Cool. Oh, well, that's great advice. Thank you very much. Where can we find you?
I'm in Manhattan, not now currently, but my office is on 86 between Central Park West and Columbus. I can send you my links for my website. I can also send you some articles if you want them.
Yes, please.
If that would be helpful. And yeah, just keep me in mind for other opportunities where we can just have a dialogue about, connecting the Asian Indian community with mental health resources.
Awesome. Thank you very much. This has been very, very helpful.
Oh, good.
I hope that's good for you.
Yeah, it was. I think this was great. I mean, for a long time, I've been wanting to do something where I can sort of give back to the Indian community, because I feel like, I think this is really important to be able to say, I have the experience and background to actually be able to help people. So,
yeah, no, thank you very much. All right, we'll talk soon. Yeah.
Good. Yeah.
Yeah. Thank you.
Thank you.
It was so good to meet both
Appreciate
of you.
it.
Okay. Take care.
Pleasure to meet you.
You too. Take care.
Take care.
That's it for the Gucci Turban podcast. I've been Nimesh Patel, Asif Mansoor. Thank you again, Dr. Meena Dasari. Follow us at Finding Nimesh, at Everybody Loves Mancy, at Gucci Turban podcast on IG. Spread the word. Next week we got a banger. See you later.